Let's talk about the headache. See, when we talk about the headache, so headache, it can be the primary headache or it can be the secondary headache. It can be the primary headache or it can be the secondary headache. Primary headache, it is just a benign conditions, like it's just for the short period of the times. But if we talk about the secondary one, so secondary one, we call this condition as the that it is a malignant type of the conditions. In primary headache, we will be having like it is a benign type of conditions, and secondary it will be like malignant conditions. Secondary it will be like malignant conditions. Then after that, remember benign, देखो, because whatever we see, like whether it is a tension headache, what is the migraine or the cluster headache, so what we will see, this type of the headache, they are the primary headache. So benign conditions, they can be the recurrent, there can be the recurrent headache. Along with that, we can see there is no disease associated with these conditions. There is no disease associated with these conditions. The secondary means that some disease due to some disorder, like some trauma can be there, head injury can be there, or hemorrhage can be there, vascular disorders can be there. So due to that conditions, we will be having secondary headache. Hemorrhage can be there, the head injury can be there, or any trauma can be there, infections can be there, and the systemic infection, it is the most common cause of the most common type of the secondary headache. Okay. Then in my primary, remember we have the three types. Which three types? We will be having the migraine, we will be having the tension headache, and we will be having the third one, that is like depending on the trigeminal's autonomic conditions. So we have in our syllabus, that is the cluster headache. That is the cluster headache. There are other example also, but they are not so common also. But that's why we will discuss just migraine, tension, and the cluster headache, and that are the important one. Now देखो, अभी let's we having the tension headache, then we have the migraine, and we will be having the cluster headache. So these are three type of the primary headaches that we will gonna discuss. If we talk about the tension headache, the tension headache, it is the bilateral conditions. It is the bilateral conditions. Migraine, it is what? It is the unilateral conditions, and the cluster headache, again it will be the unilateral conditions. Means what we will see, in the tension there will be the bilateral, migraine the unilateral, and the clusters there will be the unilateral conditions. After that, second point, remember, if we talk about the features of these headache, so in tension headache, we see there is a constant pain or the steady pain will be there. Steady pain or the constant pain will be there. But instead of we talk about the migraine, so in migraine we see there is a throbbing or pulsating pain will be there. There is a throbbing or pulsating pain will be there. After that, what we will see in the cluster headache? In cluster headache, we see there will be the repetitive brief headache. There will be the repetitive brief headache will be there. Means this headache will be the repetitive. Along with that, in cluster headache, or you in the options you got the that is some periorbital edema, periorbital pain is there. तो समझ जाना वो किसकी बात कर रहा है, क्लस्टर हेडेक की. सो इफ यू आर सीइंग रिपीटेटिव ब्रीफ with periorbital pain, so that means he is talking about the cluster headache. Second thing, important one, that is the duration. If they will ask you what is the duration of this headache, so duration, remember, if it is more than 30 minutes, if it is more than 30 minutes, like around 4 to 6 hours, so we called it as the tension headache. Migraine, the durations will be 4 to 72 hours, 4 to 72 hours, and in cluster we see that is around 15 minutes to 3 hours. It is around 15 minutes to 3 hours. 4 to 6 hours, 4 to 72 hours, and 15 minutes to the 3 hours. That is the duration of these headache. After that, there is other important sign. We see that there is a fourth one, that is about some association. Now I told you the nausea vomiting है तो migraine होगा, अगर lacrimation conjunctivitis है तो cluster होगा. Same like If the no photophobia, no nausea, no vomiting, so which headache is there? So that is a tension headache. So there is a no photophobia, and there will be the no phonophobia. So that means he is talking about the tension headache. In migraine, what we see, in migraine there will be the nausea, there will be the vomiting, there will be the photophobia, or there will be the phonophobia. So all these things we will see in case of the migraine. But if we talk about further the cluster headache, so cluster headache, what we will see, the lacrimation. Agar if you see there is a periorbital pain, along with that you see the lacrimation. Along that what you see, there is a lacrimation is there, and along with the lacrimation you see there is a some rhinorrhea will be there. Lacrimation or rhinorrhea will be there. It means that this is what, which headache is there, that is the cluster headache will be there. Migraine, nausea, vomiting, photophobia, phonophobia will be there, and cluster there is a lacrimation or the rhinorrhea. मेरे साथ बोलेंगे migraine, nausea, vomiting. Speak out with me. Migraine, nausea, vomiting, photophobia, phonophobia. Duration 4 to 72 hours. Cluster headaches, durations that is 15 minutes to 3 hours. Lacrimation and rhinorrhea. Lacrimation and rhinorrhea will be there. Cluster headache, repeated brief headache with the periorbital edema, 15 minutes to 3 hours. Lacrimation plus rhinorrhea will be there. Tension headache, no photophobia, no phonophobia. Migraine, nausea, vomiting. Along with that, photophobia, phonophobia will be there. The cluster headache, lacrimation or rhinorrhea will be there. Okay, is that clear? Again, for the treatment, if I ask you, what the treatment? There is one more thing about the aura. So aura means like if anything he's seeing, something is surrounding him. That is what we call the aura. उसको चारों तरफ घुमावता कुछ दिख रहा है, घूमता घूमता वो कुछ दिख रहा है, तो उसको क्या बोलता है? Aura. So इसमें क्या होता है? No aura will be seen. No aura will be seen. इसमें may have aura. Now aura can be present or absent. You can write it like that. Aura, it can be present or it can be the absent. In this condition, aura will be present, but aura will be associated with one condition, that is the Horner syndromes. If Horner syndromes will be there, then these patients will be having the aura. Other than that, they can ask you the treatment for these conditions. The treatment, you know, you can here give the NSAID, any analgesics can be given because this is just a tension headache. In this condition, we having the, can you tell me the profile axis of the migraine? Which profile axis is used for the migraine? The profile axis of the migraines. Which drug is used as the profile axis of the migraine? The treatment NSAID, and remember the triptan. Then the triptan is the drug of the choice for the migraine. Triptan is the drug of the choice for the migraine. Other than that, we can, in the cluster headaches, we can use the sumatriptan and 100% oxygens. And what we can use? Sumatriptan and 100% oxygens will be there. Profile axis, the Klagi was right, that what profile axis we can use for the migraine, that is propranolol, it will be used. I told you, I think in the class, in the pediatrics class. Okay, so that remember, there will be the steading pains, and sometimes we can do stabbing, sometimes we can be having stabbing or boring pain. We can call this as a stabbing or the boring pain will be there. If you see the throbbing pain or pulsating pain, that is the migraines, and that repeated brief headaches with the periorbital edema. Other than that, we will have the secondary headache, and the secondary headache, there are some dangerous headache. We can also call that as the dangerous headache. This is also known as the dangerous headache. Why the dangerous? Because it involves the CNS infection. It involves the CNS infections. The vascular cause, they can be the benign intracranial hypertension will be there. Many are the secondary, like it can be the hemorrhage due to head injury, due to the trauma, due to the benign intracranial hypertensions, or tuberculoma, neurocysticercosis, any hemorrhage will be there. So all these things will be there, and the features you will see in this condition, the features that you will see, the patients will be having sudden onset severe headache will be there. Sudden onset severe headache will be there. or like in case of the subarachnoid hemorrhage, we will be having some time of, we have thunderclap headache. We will be having headache, that is a thunderclap headache will be seen. Okay, and it's such type of the headache in which we see there is a disturbance of the sleep will also be there. So the most probably they will ask you from the tension, migraine and the cluster headache, and the cluster they can give you in the options lacrimation or the rhinorrhea. Migraine they will given in the option nausea, vomiting, photophobia, phonophobia. Tension they will not give you such stabbing or the boring pain, or you can say like band like. The tension we see the band like pain. You see the band like if the patient is there, so in that regions we will see they will see there is a band like pain. So here you will see the complete details. In case of the migraines, we will see the migraine, there will be the pain will be the unilateral pain. The pain will be the unilaterals. In clusters, what we will see, if this patient is there, so we will see the pain will be here around the periorbital. So that is the cluster headache. Okay, and this was our questions that it's showing us that the frontal region of that one-sided vision reduction is there, and what we have seen that I think photophobia, phonophobia was here. So headache or state is objectively we see high calorie diet, neurologic state has no peculiarity. So if one-sided is there, along with that vision reduction will be there. Vision reduction can be seen in this condition, that is the normal things. Don't confuse with these things with the lacrimation or the rhinorrhea, such type of the things. So and along with that, see the nausea or the stomach discomfort. So all these are associated with the migraine. Okay, about then chronic subdural hematoma or the all the hemorrhage we already discussed in the class.